I recently did a podcast on the 10 ways I believe my verbal behavior approach is different and better for kids with autism. So today in this short video blog, I want to give you the top 3 ways I believe my approach is different and better and might be able to help you help your children or clients do better too. Hi, I'm Dr. Mary Barbera, autism mom, board certified behavior analyst, and best-selling author of the Verbal Behavior Approach. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So I have, in the past 2 decades, seen a lot of ABA programs and a lot of programs where people are telling me that they're using a verbal behavior approach. They're using a BB map. They are implementing some of the procedures in my book. But sometimes when I look at those programs or I look at the BB map and the treatment plan, or I hear about kids having problem behaviors, I tend to think that professionals and parents could be using my approach to help these children more. And I know that might sound a little egotistical that I think my program is different and better than everyone else's, but I do think that there are reasons that I believe that my approach might be able to help you turn things around, even if you haven't made a lot of progress in months or years with some of your clients or children. The first way I believe my program is different is that I have a lot of experience with different hats. I fell into the autism world in 1999 when my firstborn son Lucas was diagnosed with autism just one day before his 3rd birthday. At that point, I was a nurse. I had a master's degree in nursing. I was a nurse manager, always working in the neurology rehab field. I worked with multidisciplinary teams, created multidisciplinary goals with PTs, OTs, speech therapists, parents or loved ones of the patient. So it really did prepare me. I was a nurse manager, had to deal with a lot of the organizational behavior management. I published actually in the nursing field. I published in the field of nursing retention, shift-to-shift report, and time management, all very behavioral things that I was studying without really ever hearing the term ABA or applied behavior analysis. I also, in addition to being a parent, being a nurse, I became a behavior analyst in 2003, earned a PhD in 2011, became a doctoral level BCBA. I worked for 7 years as the lead behavior analyst for the Pennsylvania Verbal Behavior Project, working with hundreds of kids all across the spectrum, all ages, all abilities. I also spent at least 7 years or 8 years as an early intervention provider with birth to 3-year-olds and in schools and in homes. After my book was published in 2007, traveled the world, and just 4 years ago, began selling online courses to both professionals and parents within the autism community. So I look at things with my many hats on. I often can relate to parents. I can relate to behavior analysts. I've worked with so many speech therapists who've done incredible jobs in helping kids. So I do think that in this case, wearing many hats does help me create programs and create step-by-step procedures that actually are effective with lay people and parents, new therapists, as well as seasoned professionals who may be very good at what they do, but they're having a hard time quickly training people without a lot of data. The second way I believe my approach is different is that I use a very common sense ABA approach, probably because of the different hats I wear and my perspectives. I know that parents are overwhelmed. They can't be taking loads of data or any data in many situations. And I am very attuned to how people best learn, how they are trained. My dissertation was on training people. So I do think that I use common sense approaches such as we all need 8 positives to every negative. I didn't create that. Glenn Latham first taught me that, but everything I do is very positive. I have thought of, if you see problem behaviors, demands are too high, reinforcement's too low, we need to flip that. We need to spend 95% of our time preventing problem behaviors. We need to avoid escape extinction procedures. So in addition to wearing many hats, using common sense strategies, I also, this is very related, I want to encourage both professionals and parents to step back, look at the forest, not the trees. We don't just focus on language. We don't just focus on problem behaviors. We focus on self-care, leisure skills, pre-vocational skills, academic skills. We look at what the parents value, the age of the child, whether they have siblings, whether, just a whole lot of variables. And so I really don't like to go right in and start what I call tit for tat programming. I did a video blog on that recently. I like to step back and really focus on the major things that kids need. Major being, can they request their wants and needs? Do they have major problem behaviors at or near zero? How is their toileting? Can they toilet themselves or with some supervision? These are the things that I think are really going to make a difference in their lives. And sometimes people jump too far in and look at the trees and not the forest. So throughout my courses, I'm using my approach, which is different than anyone else's because of my background. So if you want to learn more about the ways my program is different, you can listen to the podcast, which is episode number 15. You can go on marybarbera.com/15. And if you would like to learn more about joining my online course and community, that's really the best way for me to help you. It's a long process to learn how to shift your approach and do things positively, making more progress, incorporating parents and professionals together to help each child reach their fullest potential, which is always my goal. If you want to do that, I would love to have you at a free online workshop at marybarbera.com/workshop. If you like this video, give me a thumbs up, leave me a comment, and share this video with others. I'll see you right here next week.